සැත්කම් සඳහා ස්ථාවර අවමගාස්තු දැන් නවලෝකෙන් අමතන්න 0771
Sri Lanka continues to set record after record in its daily tally of infections. For a sixth consecutive day, the country reported cases in the excess of 1,000. And what's more, it was the sixth consecutive day of a daily caseload record. All in all, 1,891 infections were confirmed across 24 districts. The Western Province accounted for a staggering 1,014 infections, with its Colombo district confirming 387 cases. The other two districts in the Western Province, Kalutara and Gampha, confirmed 330 and 297 cases respectively. Meanwhile, the Puttalam district reported 88 cases, while Galle reported 80 infections. 71 cases of the virus were reported from Anuradhapura, while Ratnapura confirmed 70 and Kandy 66. A further 352 Covid-19 infections were reported from 15 other districts. There were also 48 imported infections among yesterday's daily caseload, the highest during the third wave. As for today, 1,046 new Covid-19 infections have been confirmed so far. During the first and second waves of Covid-19 in the island, most of the patients found were asymptomatic, meaning they did not show signs of infection. The government handled the two waves by setting up intermediate treatment centers, in addition to hospitals dedicated to treat Covid-19 patients. But those days are truly gone. After the third wave of Covid-19 blew in, the country has seen an exponential rise in virus cases, with the majority of patients now displaying symptoms. Further, the third wave is spreading the feared UK variant of the virus. The most concerning symptom is the shortness of breath that had placed a huge demand on the country's healthcare system. The need for a change in strategy has become evident.
Now the government has taken initiative to open more and more intermediate care centers for the people who are asymptomatic. This may be some training centers or some other places with hostel facilities or some other converted facilities for hostels. And also we are making available hospital beds for all the people who are symptomatic. What we need is when a patient is identified as having COVID-19, immediately removed from the society and place him or her in an intermediate care center or a hospital until they cured from the disease.
Given the foreign nature of the virus strand doing the rounds at present, the government has taken measures to ensure that there's little chance of a foreign variant entering the island and to give some breathing space to the healthcare system.
With the increased number of cases reporting all over the world, in many countries the cases are reporting without a control. So there is the possibility that people who are arriving into the country can have COVID-19. The possibility is very much higher than earlier. For example, yesterday we have detected 48 people who have arrived from overseas and under quarantine. So with that, new variants also can enter into the country. So because of that, the people who are coming from the overseas should be under quarantine strictly with strict guidelines. So because of that, the country has decided that the number of people are coming to the country should be restricted or should be controlled in a manner that we can cope up with the quarantine process. So because of that, it has limited the number of people that come in from an aircraft to 75.
In developments on the vaccine front, State Minister of Production, Supply and Regulation of Pharmaceuticals, Professor Channajai Sumanam, says that the first batch of Russia's Sputnik V vaccine will arrive in the country tonight. A batch of 15,000 doses of the vaccine is expected. In the meantime, the National Operations Center for the Prevention of COVID-19 Outbreak has introduced a new hotline for the public to call in case of any delays in transporting COVID-19 positive patients to treatment centers. The public are requested to contact the NOC PCO via the hotline 1906 if there are any COVID-19 patients remaining at home. With 967 patients being confirmed to have recovered from the novel coronavirus today, Sri Lanka's overall COVID-19 recoveries rose to 98,209. But the country's active cases keep going up, with the present tally at 12,848.
ආයුෂ සපිරේ සුප අලුත් අවුරුද්දක් වේවා. ලීව ආයුෂ්